Good morning. We're off and running here on a nice interview with our friend Jarod. Alright. And Jarod, first question is, can you briefly describe your life before your injury?
I was just like every other 7-year-old boy, playing all the time and just trying to stay out of trouble.
Excellent. Any details of your family life?
I had a regular family life with loving parents and a sister.
Great. Now, can you describe your injury? How long?
My injury occurred just about 20 years ago. I was playing with some friends near the road. I ended up running into the road and being struck by a car.
Alright, let's see if you can describe the kinds of rehab you've gone through. But first, let's inquire as to how what the nature of your injury was. Sorry.
I had a closed head injury, which caused me to lose the control of the right side of my body. It now moves whenever it feels like it. I also lost the use of my voice. I now use a Dynavox and a little sign language to communicate.
Alright, could you briefly describe what kinds of rehab you've gone through since your accident?
I spent 2 years at Dover Rehab, where I worked on motor skills. Once home, my family worked with me.
Okay. Now, how has your life been affected since your injury?
My parents took care of me until I turned 18. Then my house was turned into a group home. I now live there with 2 other people. I still have the same bedroom I had before my injury. It did make things a little easier when I came home from rehab.
Alright. And now just a few words on your social life.
I was only 7 when my accident happened, so I didn't have much of a social life to begin with. I now have a job at Walmart, which I have had for 5 years now. It's only a few hours a week, but it keeps me busy when SteppingStones is closed.
Excellent. To what extent did that affected your financial burdens?
I really don't have any financial burdens. I have Medicare and Medicaid plus my job. I've been very lucky in that sense.
Super. How do you feel emotionally, from an emotional standpoint? How do you feel?
I think I feel the same as everyone else does. I have my good days and my bad days. I do the best I can with the cards I have been dealt.
Excellent. Now, would you describe your relationship with your caregiver? We're talking about Jim here.
Jim is like the big brother I never had. I really enjoy having Jim as my caregiver. It was a nice change to have a man to do my day program. I had only had women before Jim came along. Jim treats me like a man, where women tend to mother me a little, which I take full advantage of course.
Way to go. Well, why don't you describe how you are communicating?
It is called a Dynavox. It has a touch screen. It is pre-programmed for me by the staff that work with me.
And using that, how does that make you feel, this device?
I love to talk with people. I also like to show everyone my Dynavox and how it works.
Do you have different ways that you use to communicate other than that?
I have limited sign language with the use of one hand, and of course my Dynavox.
Well, tell me how SteppingStones has been helpful in your life.
It's helped me meet other people like myself. People that are living with a brain injury.
Excellent. There are many opportunities for gathering in groups here. What is your favorite groups that you participate in?
My favorite all-time group is sign language. I also enjoy art group and the movement groups. I like being active. When the weather is nice, I enjoy going out on the walking trails.
There's one more question I should ask. The big question, why?
I like to be moving around, not sitting still. I also love the outdoors.
Excellent.
And one thing we'd like to include is, because you can't see Jarod in this oral history, we've asked Jim, Jarod's caregiver, to briefly describe how Jarod moves around, his Dynavox in a little bit more detail, things like that.
Jarod's in a pretty standard wheelchair, nothing real fancy. It does absolutely everything it needs to do for him. The Dynavox is pretty amazing, actually. It is pre-programmable, like he said, with absolutely millions and millions of options far beyond what I could even use for it. And the best thing about it is you can talk to Jarod and pre-program in anything that he wants in there, and he'll sign to you whether that's what he wants or not. So you can actually, it's not a matter of you putting in what you want to put in, it's a matter of putting it in and then asking him if it's what he wants or not. So it works very well for him. And he's, right now, it's got actual pages in it. I think he's got like 5 pages that he's dealing with right now. And 5 years ago when I started with him, he had 1 page. So, and he can pretty much navigate through all of them by himself with a little bit of help, but he's doing pretty good.
And notice that Jarod does a lot of exercises with his hands. Is that...
Jarod is mostly, when he does his exercises, he's mostly moving his right arm, which he does not have control over. He likes to do arm exercises. He's always moving that arm. I don't know if it's just to move it for himself because it's moving by itself, so he likes to control it. That's what it is.
Yeah.
He's saying yes, that's what it is.
Okay. And just a recap, Jarod was 7?
Jarod was 7 when he had his
when this
accident.
happened, so 20 years ago.
Yep.
Alright.
Yep.
Now I think if you want to just wrap it up, thank you everybody. And
We've completed the interview then with Jarod. And thanks, Jarod, putting up with these challenging questions, but well done.
Thank you very much.